Hi, I'm Dr. Steve Grinstead, developer of the Addiction-Free Pain Management System. Today I want to talk about why a lot of people undergoing chronic pain management have failed treatment attempts. One of the big reasons I believe is because as healthcare providers we fail to recognize or treat coexisting problems. Recently on my LinkedIn poll I did a questionnaire about which of the following do you see as the most common coexisting problems your pain patients experience. We had answers from depression, sleep, anxiety, trauma, eating, and then we had some that weren't on the poll that people wrote in about, were patients feeling hopeless and helpless, people given wrong messages, people shamed and blamed. There's a lot of different reasons why people fail with their chronic pain management. The most common co-occurring problem I see is depression, followed closely by sleep. When people live with chronic pain, it can be quite depressing. So in order to heal this and help people get more effective and healthy outcomes in their chronic pain management, we need to look at what else is going on. We need to look at the whole person rather than just use a Band-Aid approach and do symptom management. Unfortunately, most of the pain management in this country is monomodality. That means just one modality. And that modality is write a prescription for pain meds. Unfortunately, for many of the people, this leads to an escalation of side effects and problems up to and including addiction. Other people take the pain medications for a period of time and they seem to work, and then they develop tolerance and it starts taking more, and then the side effect profile starts getting worse. A lot of the medication that's being used for chronic pain management was developed and approved for acute pain management. We're looking at some other alternatives. In Pain Medicine News today, I saw some really exciting statistics about the use of cortical stimulators and neurostimulation for pain management to reduce or even eliminate the problematic pain medication. I'm also starting to look at seeing that more providers are recognizing the coexisting psychological problems and getting people referred out for psychological help for their symptoms. We all need to stand up and say, what's been working really poorly needs to be fixed. We need to get out of this horrible problem. In 2011, the Institute of Medicine stated that they see chronic pain as a national epidemic affecting as many as 116 million Americans, and we're spending well over $600 billion a year in chronic pain management and lost productivity. This has got to stop. We've got to start working smarter, not harder. We've also got to start empowering people to be active participants. We need to start working with the whole person. We need to help people also achieve freedom from suffering. Every time I work with my patients, I promise them that if and only if they're willing to do the footwork, they never have to suffer with their pain again. I'm quick to tell them that doesn't mean you'll never have pain, but you'll never have to suffer with your pain. I've been living with my own chronic pain for well over 30 years, but for about 29 of those years, I have not had to suffer, and I don't ever want to go back to that. And I believe that freedom from suffering is everyone's right, and it's also their responsibility. To learn more, if you're watching this on YouTube, go and read my blog on this topic at the link below this YouTube video. I really want to help make a difference, and please pass this on to people that need to hear it. Thanks.